the question is, Raji, should you even be where you are right now, or should you be back home in Sri Lanka, because that's where your mitochondria are going to be happiest. Yes, the challenge is at a soul level because of the messaging that's pushed out through mainstream media, through social media, the expectations that are being pushed out upon young boys, young girls, young men, young women, mothers, fathers, on how they should be as parents, and what's right and what's wrong, and polarization, masculine versus feminine, feminism, toxic masculinity, not understanding like what masculinity is, what femininity is, and that's coming from both genders. Hey, hey,
Hello.
how are
I'm
you?
a news reporter with this mic. How are you?
Very well, how are you?
I'm good. It's night for you. I forgot that. Yeah, we're so far in our time zones. What time is it over there?
It's only 7:30 p.m. at the moment, so yeah, not too
How
bad.
was Eid? Was it nice?
It was great, thank you. It was great. It was nice to spend time with family. The kids loved it. We make a big deal of it at home, so the kids are starting to like remember it, and they look forward to it every year. So it was good.
And are your wider family, your extended family there in Australia too? Like your parents or aunts, uncles?
Yeah, both sets of grandparents are here. All grandparents are alive for the children. So and we've got a couple of great grandparents as well. So it's yeah. So sometimes we have four generations in a room, which is pretty cool.
Yeah, that is cool. I love that. Yeah, we have that too. Actually, my sister's got two kids, and thankfully, both of my grandmas are still here, so we get to
Awesome.
enjoy that too. So you know when you're a kid and you're like really excited about something and you're really looking forward to it. That's exactly how I felt about this conversation. I'm like,
Awesome. Also, no, I'm looking forward to it as well. So I'm excited because I can definitely like express more of my faculties.
yeah, yeah. And I just feel like we're probably on the same wavelength on many issues and many
Mm.
aspects of reality and beyond. So that makes it really fun as well. So welcome to Tales of Transformation. That's what this is called. The inspiration here is to give people permission slip to expand spiritually in their well-being, their health, that idea of abundance beyond money. Um,
Yep.
and to live in a sovereign way, to live
Yep.
in a way that's true to their hearts and their souls. So that starts with many different aspects of our being, our physical wellness too. So let's dive in with the question of quantum dentist, because we've heard of biological, functional, holistic dentistry. Um, so you're looking at the quantum, those subatomic particles. Tell us more.
So by quantum, yes, I mean I'm looking at subatomic particles, but I'm also looking at the nature, or respecting the nature of the system that is our being, our vessel, and that really is a quantum thermodynamic system, which is a very long, complex thing to say. But what is a quantum thermodynamic system? Well, thermodynamics is all about heat transfer and energy flows. Um, Quantum refers to the flow of information. And so, really, what is traveling through us at all times is a flow of energy and information. And the information is what our body uses to govern how much energy should flow, when it should flow, and all that type of coherence that our body requires in order to have flow and health. So that's, I guess, the key thing about the quantum thermodynamic system. The other aspect of it is the fact that it's non-linear, because when you have one small input from the environment, the body has coherence mechanisms and pathways within it to amplify that small environmental input and magnify it to something quite profound throughout the body or to a distant part of the body. And so that can be, one photon of light coming in through the eye, touching the retina, and being amplified a millionfold. And we know that to be true in science. So it's really appreciating that non-linear aspect to our being and then relating that back to the mouth, because the mouth is this often ignored little brother of health of the body, which everybody knows is a part of the family, but nobody's really paying much attention to him. So he's the ugly duckling, so to speak. And The reason that it is often ignored is for a few reasons. I think there's an issue around public health policy globally, and not necessarily prioritizing the mouth. I mean, dental caries is one of the most common forms of infectious disease, um, and so dental caries. What I mean by that is dental decay. But the other aspect is the fact that we as a profession don't necessarily understand and respect just how global an effect disease and dysfunction inside the mouth can have throughout the rest of the body. And so if the very people that are providing care within that space of the mouth don't necessarily know entirely what they're doing, who's going to make a racket enough to help force change, to help the market demand change from government policy, etc. And so there's a lot of great work being done in terms of like functional dentistry and biological dentistry to raise awareness about things like mercury fillings and fluoride in the water, and there's ideas around root canal therapies and all that type of stuff, and there's definitely merit to that. But they're all still stuck in that kind of paradigm of biochemistry, which is what much of functional medicine is stuck in. Whereas if we look at the physics, the biophysics, and the structural function of the mouth, the vital aspects to the mouth. By vital I mean like the aspects of teeth sitting on meridians and the acupuncture, traditional Chinese medicine, etc. There's you could write like a massive encyclopedia just about the mouth. So maybe that's something for me to do one day, but this conversation is the start.
Yeah. Okay, thank you. That was that's really insightful, because I mean, the last couple of days I whizzed through a couple of the conversations you've had. Loved the Regenerate Summit, found that on YouTube, and I was like, he's my mentor and he doesn't even know it. Just so
You're very
inspired.
kind.
Yeah, so inspired. And just in case anyone doesn't know, I'm a dentist too. I've been practicing for 12 years. I've always kind of snuck in the little holistic stuff with my patients, but I've always worked for somebody, and often for organizations, which means as much as I want to completely rewrite the book, it's very difficult. What would you say to dentists who are out there who really can hear what you're saying and it's hitting them in the soul and they understand it and it makes sense and they want to implement this? What would you say are good starting points?
A good starting point is to get very comfortable with discomfort. A good starting point is being comfortable being on the envelope, like right at the end of the envelope of what is acceptable as care, because or what is commonly accepted as care, because that's where I believe I am at the moment, and it's occasionally disconcerting because it is so far out there that like it doesn't gain traction with any of my colleagues, and what I have to say falls on deaf ears. Many of my colleagues, they observe me on Instagram or Twitter, etc. And not that I post my material for likes and satisfaction, etc., but more to raise awareness. But I mean, it doesn't even pique their curiosity, and so it can be a lonely place sometimes. But it's the place that I have to be, because I guess another message to dentists is to stop thinking about serving yourself, but start thinking about serving others. And when all your work and all that you embody is service to others, then the universe, this quantum realm, is going to take care of the rest, and is going to connect you to the right people. Or you and I having this conversation. I mean, I've been a dentist for 12 years as well, and it took me at least 6-7 years to really break out of the mainstream mold, and really break out of what I was taught at university, and that centralized approach to just focusing on teeth and just focusing on fillings and drill and fill and appreciating that there's a much bigger picture.
Yeah. Yeah. And I echo that, you know, being willing to be uncomfortable and to be seen as kind of odd and weird. I definitely get those looks and the comments, but to keep saying it and to be able to justify what you're saying with speaking to other people, doing your research, and it takes a hell of a lot of research. My goodness, like it's like the rabbit hole gets deeper and deeper, and understanding yourself, implementing it on yourself, and being an embodiment of it. And you're right when you say that when you do take it on and you trust the field, you trust God, whatever you want to call it, you are brought people and opportunities that line up with the mission that you're holding. I definitely have felt like, oh, I don't even know if I want to do this. And then suddenly this year, I'm meeting people, I'm coming across people who feel the same way or are steps ahead of me in implementing it and driving that forward. I'm so grateful. I'm so grateful that I was like holding this frequency of like, there has to be some way that this makes sense, and coming across people like yourself. Have you found other people in your field, in your little circle, that are mirroring your views?
Definitely patience, which is amazing because that allows me to apply what I'm learning, what I have learned, and really putting it out to field test to be sure. And as each day goes by, as each week goes by, my my general my genuine, I guess, what's the word I want to use? My genuine feeling of, okay, this is really something, this really works, this actually is a major leap forward in dentistry, is it's so profound that I feel more compelled to shout out louder from the rooftop so that more and more people can hear about it. And I appreciate that the change is most probably not going to come from the industry, and that's okay, because as long as I can reach just the normal mums and dads, people that are struggling with jaw pain, people that are struggling with pelvic pain, and get them to think a little bit different the about how the mouth could have a role to play in that lower back pain or that pelvic pain, etc. Then what we're going to eventually achieve is this mass shift where enough of the market demands dentists to have this level of knowledge. And that is then going to force dentists to go and have to upskill and level up so that they can provide that care.
Yeah. Yes. Yeah. And I love how you mentioned it being kind of driven and supported by the mums and dads, by the parents of these children.
Yes.
Because they almost hold the wisdom that we don't, like, about their own children. They know more than we do about their own children, and it's almost like following what they've noticed in the time that they spend with their kids and things that we wouldn't see outside of our surgeries. Are you noticing that?
100%. So a huge aspect of what I trust is the parent's intuition.
Yeah.
And allowing the parent to just talk and express, and oh, I remember that, oh yes, and this, oh yes, and that, and giving them time within the consult to dig deeper into their library of memories about their children, to eventually find the one or two things which might take 15 minutes for them to express, which are like, okay, that's it, or so it's definitely a labor of love. I take time with my consultations. They're not 15-minute consultations. It can take me a long time to even look in the mouth because I'm just talking. I'm holding space. I'm listening to hear, as opposed to listening to speak. I'm trying to play less of this like practitioner, clinician type of mold and more of like just someone that's here holding space and allowing the parent to express themselves or allowing the patient to express themselves. And So there's less of like this kind of godlike figure or aspect to what I think a lot of mainstream medical practitioners have in their mind, that they're the ones that are making decisions about, you know, what investigations to make, and what is the diagnosis, and what's the treatment, and how long does treatment last for, etc. Whereas a lot of my investigation is just trusting the parent intuition and harnessing that and leveraging that in a way to deliver the right treatment plan for the right length of time, and also allowing the body to tell me when it's time to stop treatment, or is the body not ready yet to finish treatment? Can we keep going? And that requires a very deep level of understanding of how the body works, which is at a structural level, at a biophysical level, at a biochemical level. And there's a lot of things that I've learned working alongside my osteopath, and he's got me to think a lot more like an osteopath, which has been really liberating for me as a clinician, because it's freed me from like the last clutches of anything mainstream that was really holding me back, and really kind of just let me run. And it's just super, super exciting.
Yeah. You mentioned the connection between the jaw, the mouth, and the pelvic floor. Yeah, I love this, and I'd love to go there because I know a lot of women who have TMJ issues who also have pelvic floor issues. Do you want to talk through how that mechanism works?
I certainly can. It's a long answer, so we may have to work our way through things.
Yeah.
But really, it all starts at like this concept of the craniosacral mechanism. And so the craniosacral mechanism is a reference to the fact that the bones inside of our skull are all moving, and they're all moving ever so slightly. Um, they're moving kind of the walls, the bones on the side of our head are moving out and they're moving back in, and so we call this like an external rotation and an internal rotation. And then the bones at the front and the back are they're like flexing and extending, and so they're moving forwards, they're moving back, and all of this pivots off this key central junction between what's called the sphenoid bone, which is the keystone of the skull. It's kind of like right in the middle of the skull, and behind the sphenoid bone is the occipital bone, which is the base of the skull, which sits upon the first cervical vertebra. And so the sphenoid bone and the occipital bone, they're doing this like flexion extension, and that movement drives, and the movement of the cranial bones in sync with the movement of the tailbone drives the pumping of something called cerebrospinal fluid. So the cranium is connected to the tailbone physically by something called the dura mater, which is this very thin, tight, taut, tension type of membrane. And to kind of explain, I kind of think of it as like the membrane on the top of a drum that the drummer is beating. It's very tight, very thin, very strong. And so it wraps around the entire spinal cord, anchors into the tailbone, wraps around the entire spinal cord, enters through the bottom of the skull, and then attaches into different spots within the cranium, within the skull. And then inside of that is the spine. In between that and the spine, or in that area, is this cerebrospinal fluid that I'm talking about, which is this body of water. It's an ultra filtrate of blood. So it's like 99% plus just water. And and the cerebrospinal fluid is pumping down the spinal column towards the sacrum, the tailbone, and then getting pulled back up into the head, and then getting pumped back down and pulled back up. And so that motion of the cerebrospinal fluid is absolutely critical to health. In addition to the craniosacral mechanism, we have to consider the parasympathetics, because the parasympathetic nerves within our autonomic nervous system exit via the cranium and the sacrum. So if the cranial sacral mechanism is not right, if the movement of the bones is not in sync, if they're locking up and jamming up, and we can talk about later about what can cause those, then you have inadequate flow of parasympathetics. You have inadequate vagal tone. which affects gut function, which affects breathing, which affects so many things. And so that's kind of like the centerpiece of it all, because you have this literal physical connection between the tailbone and the head via this dura mater membrane. So if someone's a ballet dancer, for instance, and at 7 years of age, they slipped or had a bad fall on the tailbone and it was bruised and they found it difficult to walk for a week or so, what that actually can result in from that fall is like a strain in the tailbone, where if the tailbone like was sitting like this, it's kind of maybe twisted one way or it's like stuck in extension or flexion, etc. And the hips attach at the back with the sacrum. So if you have a strain in the tailbone, that's going to create a compensatory twist or strain in the pelvis, in the hips. And that strain in the tailbone is going to be passed up through the dura mater membrane, and you're going to get a compensatory twist and strain in the cranial bones. And the jaw, the lower jaw, mandible, sits in something called the temporal bone, which is on the side. And so if the temporal bones get locked and they're not able to move properly, then you have one side of, because you've got two temporomandibular joints here. So you have one side of the lower jaw is kind of more forward, the other side is more back. And so then that's how you have a literally direct connection between TMJ issues, lower jaw issues, and the pelvis. Not to mention that the TMJ joint capsule, the jaw joint capsule, is like heavily populated with estrogen receptors as well, which is why women are more prone to having TMJ issues compared to men.
I didn't know that. That is so fascinating. What about fascia, like the fascial connection?
It's massive. Like fascia is like a sensory organ, which is not even thought of as a sensory organ by most people. But it's like this one continuum of
Mm.
like it forms the cytoskeleton inside the cell. It's like the interstitial fluid. It's in between one cell and the next cell. It's like the extracellular matrix. It's like, so I'm like looking at the concept of fascia like within the cell, but then in between cells, and then what forms the tissue, and then the tissue is part of like this whole organ system, and then all the organ systems, and then you've got like literally the major kind of highways like the M1 in London, for instance, that's connecting, London to, I'm not sure where the M1 ends up, but you know what I mean. So like up north. So like you've got these long, expanses of like fascial highways inside of our body that are connecting, input, proprioceptive input from the feet up to our head, and vice versa. And so when the body is unable to convey to the cranium what's happening in the feet because of a bend or twist in the bones, which then affect the way that the fascia falls around them, then you literally have like a crash on the M1, 1 hour north of London. And so the traffic gets banked up, and then there's inflammation, and then there's knots, and there's trigger points, and all this type of stuff. And in that whole space, you can make progress as a physiotherapist, but you're going to make better progress if you focus on the bones, because the muscles and the fascia and the ligaments, etc., they all attach into bone at the end of the day. So the bones have to be in the right place.
Mm. And with respect to that craniosacral connection and an impact at the sacral level, creating this movement or something locking up in this area, I suppose it works the other way too. If you had trauma to your head, you're going to get locking up of the sacral region. Is that correct?
But look, it's not a definite, but it's a potential.
Yeah,
Because so it needs to be considered in an assessment.
yeah, yeah.
And so I mean the causes of these lockups, like it can be a physical trauma, like a dancing incident, or riding a horse and falling off your horse, or it could be climbing a fence or the monkey bars and at the park when you're 9 years old and falling and landing on your head. It could be playing cricket, not wearing a helmet and getting hit in the head by the cricket ball from a fast bowler. It could be a birth trauma. It could be the way you were born. Was a cord wrapped around your neck? Were you like an emergency C-section? All of these types of things. These all have huge roles to play in the movement of the cranial bones, and it's often ignored, and something which I had ignored for several years as a clinician until I really understood the impact of how like the mouth is really a part of a much bigger system. I mean, as you know, as dentists, we're trained to just think about teeth. Really, few of us appreciate that the teeth are housed in bone, but even less of us are able to appreciate that these jaws, these bones that the teeth are housed in, are actually part of the cranium. And we are, in a way, osteopaths. We just are working on different cranial bones.
Yeah.
But we need to start thinking like that.
Yeah. So let's talk a little bit more about moving teeth and um, traditional orthodontics and extraction orthodontics versus um, expansion. And you're working with an osteopath, so you're measuring how much expansion is tolerable for each individual. How are you making those decisions, and how important is it to do it that way versus extractions or just moving teeth into alignment so they look pretty, and what impact might that have? That's a big question.
It first starts with understanding why are teeth crowded in the first place. Because we are led to believe that teeth are crowded. So, like if you look at the work of Weston A. Price, which is fabulous work, Nutrition and Physical Degeneration was his book, and decades ago, probably 50 years ago, he went around, and might be even more than 50 years. Correct me if I'm wrong, but he went around to many of the native indigenous tribes around the world, in Africa, in Australia, in North America, etc., and observed their health and observed their dental health. And what he found was that many of the locals that had kind of been untouched by Western society, so to speak, had like perfectly functioning bodies. They had beautiful mouths. They had beautiful breathing. They had jaws that were wide enough to accommodate all 32 teeth. So they all had their wisdom teeth. And so it was quite a profound finding for him.
Yeah.
And so he attributed that to the fact that they were eating whole foods, they were eating locally and seasonally sourced foods, they were chewing through their food. So it wasn't like they were being spoon fed, yogurt or puree or something. So like they were using their bodies, like their jaws, functionally to eat their food, as well as the nutritional component within the food, because they were eating organ meats and so like vitamin K and all this type of stuff. And then obviously they had adequate vitamin D levels because of sun exposure. Because with vitamin D and vitamin K, what happens is vitamin D is the carrier of calcium, but vitamin K is like the address on the envelope or vitamin K2 to be specific, is the address on the envelope that tells the postman where to put the calcium. And so there's no point having vitamin D unless you have adequate vitamin K levels. And you source that from things like organ meats, etc. Later we might talk about why vitamin D supplementation is not a good idea. But anyway, I digress. So there is this awareness and understanding of the importance of nutrition in dental health, jaw development, which is definitely true. But the other often missed area, which I feel is more important, is that of craniosacral mechanisms being locked up, and we've already expanded and touched on that. So what happens is when the cranium is locked up, the jaws can't actually grow as big as what they need to grow. They can't descend down and forwards out of the cranium. So the cranium holds them back, and that leads to smaller jaws. That leads to a tongue that's further back in the head, which cramps the airway behind, which makes it harder to breathe, which sets somebody up for snoring or sleep apnea, etc. But when you have a small jaw, obviously then you're going to have crowded teeth. And so the crowding of the teeth, more often than not, is due to the compression or lockup within the cranial bones. So it's much like you have a projector that shines the movie onto a projector screen. I see the cranium as projecting its strains and lockups and compressions into the mouth. And so the more and more I do this work now, I'm starting to see typical tendencies like if the lower back teeth are tipped in, towards the tongue, that tells me that the cranial base is locked up. When I see upper premolar teeth that are collapsed in parallelly, that tells me that the temporal bones are locked up. And so you start to able to map the entire cranium and what's going on just by looking inside the mouth, or taking a step back and looking at someone's face and observing, is one eye higher than the other? Is one ear higher than the other? Is the upper jaw going to the right but the lower jaw is going to the left? And then you can start to really piece together what's actually going on with this person. And what we appreciate then is that you have a misaligned cranium that is driving misalignment in the teeth. The question though is, Raji, is that a mistake? Because in my mind it's not. Because the body is pretty intelligent, you and I would both agree. And so is the body using its intelligence to put teeth in a specific way so that you can continue to do your ballet, you can continue to ride horses, you can continue to play cricket, so that you can continue to breathe, so that you can continue to walk, so that you can continue to function, so that you can continue to chew? And the answer is yes, it's doing all of that on purpose. So what we do as a profession is we take these crowded misaligned teeth, which I deem as functional, so I would call it a functional misalignment, and we straighten them, and we turn them into a dysfunctional alignment. So now it's straight, it's aligned, but it's completely dysfunctional. And so the body's like, what did you do that for? Like, I needed the teeth over there. I needed that tooth twisted this way. And so the body's like, I'm going to move them back. And so this is why we have something called orthodontic relapse, where you move the teeth, they start to move back to the way that they were. The people aren't happy, so they go back to the orthodontist, and the orthodontist is like, all right, you know what we'll do? We'll move them back, and from all my cases going forward, I'm going to put a retainer in so that the teeth don't move back. And so then there's removable retainers, which people wear while they're sleeping, or fixed retainers where they literally have a wire that's stuck to the back of teeth, holding the teeth in place. And then the body's like, well, that's not fair. I wanted the teeth there. I was going to move them, but you've like bolted them all together now with this wire. So if you're not going to let me recreate that compensation that I needed, which was misaligned teeth, I'm going to have to compensate with another structure. So it's going to have to be your left TMJ, Stuart, or Isabel, it's going to have to be your right pelvis.
Yeah.
And or you know, Raji, it could be your C1. And so the body has to, purely for survival, sacrifice a different part of the structure. And so the big paradigm shift forward is actually, you know, it's redefining orthodontics. And that means first doing the orthopedics right before the orthodontics is done, getting the bones right first. And that does not mean an expander, because the expand or the word expansion is not appropriate in dentistry as far as I'm concerned, because it's, to me, looking too linearly, and we're a non-linear being. It's just looking at left to right. I want to make that upper jaw wider. I want to make that palate wider. That's expansion. I prefer to use the word development, because we're looking at the upper jaw. If you think about it, it's the side wall of the nose, it's the floor of the nose, and obviously it's the part that houses the teeth, and it's a significant portion of your cheeks, which is what houses the maxillary sinuses. Yeah. So this upper jaw, this whole section here, okay, it's a 3D structure. So do you want to move it linearly from left to right? Because if you do this part left to right too quickly, the top part's going to actually collapse in. And there's studies to prove that. Also, you're going to usually end up with some sort of asymmetry where the expansion is more on one side compared to the other side. And so the face actually looks different. So this whole idea of expansion is a very mechanical approach. It's once again the dentist playing the figure of God. It's like, okay, let's put something in. Let's, you know, anchor it into the mouth or cement it into the mouth. Let's use a screw to turn it once a day or once a week or, you know, once a fortnight, etc. And once we get sufficient expansion according to an algorithm which has been, designed by some guy with no hair, and lots. I'm not bad mouthing people with no hair. Um, some old some old professor that's archaic in his thinking, and that figure is usually 36 or 38 millimeters from one molar to the next molar, and applying that same algorithm to every single person, whether they're 6'3" or 5'2", and not appreciating that different people of different sizes need different sized mouths. I need a bigger mouth than you because I'm a bigger frame. It's purely as simple as that. But if you have the mouth that's the same size as me, it's not going to suit your body. Your body's not going to like it. And so if there's an over expansion in one part of your head, is there going to be a compensatory compression in another side of the head? And so this is what the body does. And so how do we avoid over expansion? How do we know when to stop? Which was a question of yours. The answer is that you use appliances that mimic biology. So you have to understand the forces that the body uses to grow the face, and that is the tongue, no doubt. That is, more importantly, though, the movement of the cranial bones driving the growth of the face forward. So using those and mimicking those forces, so understanding those and mimicking those forces. And so then what happens is every time you adjust the appliance so that you can affect some more growth, and then you do that once a month, and you have the osteopath there to work on the head at the same time as I'm adjusting the appliance to ensure harmony between the cranium and the upper and lower jaw complex together, so that as you walk a patient through treatment, the entire length of treatment, the head is happy with the mouth is happy with the head, and vice versa. At the 18-month mark, at the 24-month mark, come to your next appointment. I adjust the appliance, and all of a sudden it locks up the head. The cranial bones just lock up, and the osteopath can try and do whatever maneuvers they want to do. But we get to a stage where it's like, well, the cranium's not happy with that overexpansion. So then you adjust back, and the cranium's happy. And you're like, okay, we need to stop. Then you double check. Put your tongue up against the floor of your mouth for me. Yep, that fits really nicely. Your tongue's got sufficient space. Bearing in mind, along the way, we've walked patients through breathing retraining, through myofunctional therapy exercises to optimize tongue and lip posture. And so now what we have is a fully functional unit where the head is supportive of the mouth is supportive of the head sits nice and straight on C1, the spine's nice and happy, tailbone's happy, happy days. So now that you have a coherent system where you've realigned the mouth, but at the same time you've realigned the head, what you have is a system where you don't need any retainers anymore. So, I mean, you get it, and hopefully other dentists, if they're listening, get it. But that's pretty much one leg of quantum dentistry that I do. I'm not sure if you know about the other leg, but yeah, that's the big leg of it.
Yeah. So this is fantastic for parents who are on board, who are getting to you early, who are noticing things in their children and getting that intervention, and having you working alongside your osteopath to make sure you're listening to the body's intelligence and asking the body, like, what is the limit here, and working with them slowly. What would you say to adults who have already, like myself, I've already had as a child, 10-year-old, had my premolars out. My maxillars, my palate is narrow, it's high. My teeth have moved. I've definitely got asymmetry in my face. I've got dodgy left TMJ. What would you say would be to the path to many, many people I know, like in that position, to correct that? Because most people are going Invisalign and getting clear aligners because their concern is mostly in the teeth and the alignment of the teeth. But for those who are on the same page as us, what would you say are the steps they should take?
So, to me, the best appliance from a dental perspective to use in this instance would be the ALF appliance, which stands for Advanced Light Wire Functional Appliance. And it was designed by a dentist and an osteopath probably 30, 40 years ago. So it's actually a very old appliance, except that it's just never really become mainstream because it really requires a deep understanding of osteopathic principles and the movement of the cranial bones and cranial strains, and working alongside a cranial osteopath, whether it's in the same room or the patient sees the cranial osteopath soon after, because that's absolutely critical. So you need a dentist to be able to make the ALF appliance, but then you also need a dentist that's willing to look at things from an osteopathic standpoint, because any dentist can make an ALF appliance, but on its own, it's not going to be effective and could potentially be like, if I'm just adjusting an ALF appliance but not having someone work on the head to um, create that harmony and coherence between the head and the mouth and the ALF appliance, then that's when we start to head down the road of causing damage potentially, because we're pushing too much as opposed to allowing the body to do it. So, I mean, that's the appliance you use, and I've kind of walked you through like the protocol in terms of like regular appointments with a cranial osteopath to create that harmony between the two, and all of a sudden, your left TMJ starts to feel happier. Your eyes are now at the same level because your sphenoid bone's nice and happy, and gut function improves, or this or that.
Do you have the appliance with you? I know we mentioned maybe bringing it along.
Yeah, like, I mean,
Made earlier.
I'm personally wearing one at the moment. Not like right now, but like I wear one. So that's kind of what the ALF appliance looks like. There you go.
Oh,
And so you've got kind of two areas where it clips onto the molar teeth,
mhm.
and then you've got these omega loops, one here, and another one here. And you'll know like a lot of the dental malocclusions and crowding that we see in the mouth, they have an omega like nature to them.
Yeah.
Like you'll see omega shaped arches. All right. So if you're familiar at all with the concepts on homeopathy of using like to treat like, all right. So this is essentially respecting homeopathic principles, which is another reason why I know it's the right appliance. Plus, that really just sits on the inside of my upper teeth. And so when I put it inside my mouth, it is, you can't see it when I smile because it's hiding behind my teeth. So what it's doing is mimicking the pressure points of the tongue, because the tongue is also a key structure that's used to stabilize the cranium. So I'm wearing something that's stabilizing my cranium, developing my upper jaw, remodeling my face and head, so I can still talk to you while I'm doing it.
And it's not applying force to the teeth. We're not forcing the teeth to move. Is that correct?
We're not, the teeth will move because of the changes in bone,
Yeah.
but we're not using the appliance to force the movement of teeth. Is more a guidance.
Yeah. And I guess, so if someone was to undergo that treatment and they were collaborating with their dentist and an osteopath, and they were moving their palate to the extent that their body wanted to, the teeth will automatically find their alignment, which will probably be, the alignment that people were looking for with these invisibraces, etc. Is that correct, that they'll find their way?
Yeah, most definitely. Or they will get pretty close, and then you need the orthodontics just to fine tune and correct. So, like, think of this as more an orthopedic appliance as opposed to an orthodontic appliance. We're focusing on bone. I tell my patients there's a high chance that you'll be very happy with the bite and you'll be happy with the smile, because the body's intelligence will put the teeth where it wants them to be. But if that's not the case, don't be upset, because there was always a possibility that we couldn't get the job done entirely with an orthopedic appliance and you need some orthodontics. In which case, obviously, my preference would be clear aligners, just because I think it's gentler on the system compared to braces.
Compared to fixed appliances.
Mm, yeah.
Yeah.
Because the other thing about fixed appliances as well is that like the upper jaw has a suture line right down the middle of it, right down the middle of the palate, and so it behaves in two halves.
Mm.
And so if you have something that kind of crosses, that's rigid, that crosses over that,
Yeah.
you lock in the entire mid face, so that person's face can't breathe. And so if you think about the training that you had, we're told to make dental splints and we're told to make upper splints, and they cover across that intermaxillary suture there and lock up, which is why some people are like, "Oh, you made me this splint, doctor, but I hate it. I just can't wear it at night."
And this type of treatment, is there in adults where they've perhaps, or we're sold this idea that they've reached their growth potential? What about even in maybe women who are pregnant, who are already under a load, right? They're supporting the growth of a child. Their minerals are, I mean, we're all so mineral depleted. I'm sure the child is taking some of the supplies from the mother in order to support their own growth. Is this something that they should probably wait until afterwards or do it beforehand?
It's a really good question you raise. I think it's probably better to wait afterwards, just because the system's being asked to do so much at the moment. Do we really want it? Do we really want to ask it to, grow the jaw more and remodel the face, remodel the cranium? Like, that's a big ask for anybody to handle, let alone when they are also growing a child inside of them. So, it's, yeah, definitely something which I would think about much more later on, perhaps a year after childbirth, maybe even 2 years, once the breastfeeding is complete, once the mother has recovered at a biochemical level, at an emotional level, at a spiritual level, so that she's ready to take that next step. So it's like, I mean, so much of childbirth is not necessarily just about the child; it's about the mother kind of going from like woman into mother as well, and that's not just a 9 month gestation and then um, a labor. There's like an entire postpartum period that needs to be respected and addressed, and the mother needs people to hold space for her for that. So yeah, there's a lot more to this face regrowth than just, oh yes, here's someone that needs my help, that's got an asymmetrical face. Let's dive straight into it.
Yeah, and even the preconception phase of her preparing herself energetically and spiritually and physically,
Mm,
all those things, it might even be a time to avoid it then. Would you agree?
I would say so. I would say so. I agree.
Yeah. So I understand that you also do health, a kind of quantum health coaching, and as part of that, you're also supporting women in conceiving. And I know this is a huge problem in like the infertility rates now are just wild. Um, and I think it was in the Regenerate Summit I heard you say that the cell with the most densely populated with mitochondria is the female ovum. Can
That's
you
correct.
tell us a little bit more about the significance of that and how that plays a role in a woman preparing for conception?
Yeah, sure. So the mitochondria are like these organelles inside of our cells that are producing energy, but and that's the most commonly known fact about them. But the less known fact about them is that they're not just energy producers; they are also environmental sensors, and they are sensing the environment that the person is living in, and they are coupling that to the light that's coming into the eyes, to the food that they are eating, to the light that is coming onto the skin, and they're kind of like this auditor, and they're checking and they're cross checking and then matchmaking and making sure that everything matches nicely. And then from that process of auditing, there is an exhaust, much like a car has an exhaust, and that exhaust is oxidant, and these oxidants are released by the mitochondria. Now, the thing is that there's this big push about, oxidation and like, got to have antioxidants and all this type of stuff. But the truth is, you actually need the mitochondria to release some oxidants, because those oxidants travel towards the nucleus inside the cell and tell the DNA how to express. So the oxidants is like one of the key signaling molecules that conveys the information that the mitochondria has received from the environment, and then is using that to tell the DNA how to express, which and if that affects things like cell replication, a whole host of other things. So if you have that entire system where the most number of highest density of mitochondria inside a cell is the female ovum. That is essentially saying that the female ovum is best primed to sense the environment. And so when it's sensing the environment and things aren't great because there's Wi-Fi while mum's sleeping, there is a lot of blue light coming into the eyes and onto the skin late at night throughout the day. There's sunlight avoidance, there's the wearing of sunglasses, there's sunscreen, there's inadequate nutrition levels, or eating a lot of processed foods, etc. And we can maybe later on, if you're willing to go deep, talk about why people would make those choices in the first place. Because it's not necessarily their fault.
Yeah.
Then what happens is the mitochondria is just like, this environment is just not conducive to a 9-month gestation. I'm sorry. And so a lot of fertility is related to inflammation, which is a loss of electrons, too many oxidants coming out, too many, not because you need to have the right amount, but it's about having too many oxidants coming out, and that's fundamentally why most infertility is occurring, because there's just, in addition to hormone dysregulation because of the wrong light coming into the eyes, because the eye is conveying the light information back towards the hypothalamus and pituitary, which leads to the release of steroid hormones and all these types of things. So then there's the stresses of life and there's a whole host of things, but like circadian dysfunction, hormone dysregulation, mitochondrial dysfunction are like all really central. Not to mention, of course, has there been a history of physical or sexual abuse which has been stored in that tissue, within the fascia, and is that tissue just saying, I don't want to go back to that? So I mean, I've had a case of that, where endometriosis stemmed from a mother who, sadly, unfortunately, was a victim of sexual abuse as a child, and her body was holding on to that. And once that was released, she was, thanks to God, able to conceive.
Yeah, such a huge emotional and energy component, how we're storing energy, trapping energy is getting trapped in our first 3 energy centers of that kind of survival and stress. And once that energy is liberated, it opens up our system to self-heal and create life as was intended. Yeah, wow, that's incredible. So if, at a basic level, if a woman was saying, I've been wanting to conceive for years, for months, for whatever, the first thing to say is get outside, get some sunlight, eat real food, block blue light at night, and I suppose in the morning too, because there isn't that much blue light in the morning. I'm gathering.
That's correct. There's like a bell curve. The blue light's quite low at the start and end of the day, and it kind of peaks around lunchtime. So, I mean, I'm not wearing glasses at the moment to block the blue light, but that's because my computer has a filter on it that blocks all the blue light. Though I do have a red light lamp next to me just to kind of balance things out nicely. And for those that are watching, like, it's a dark space right now where I am. I'm sorry, it's not necessarily good viewing, although perhaps it is because maybe my hair's a bit out of place. But the reason it's dark here is because I'm trying to mimic nature. Like, it's dark outside right now, and so we need to embrace nature. We need to get outside. We need to ground. We need to get rid of like dirty electricity that is stored within our body and like send it down into the earth. We need to bathe in sunlight safely and responsibly, understanding how to build a solar callus and things like that. So, I mean, these are not all things which, I can, like, a solar callus, for instance, like, there's nuance to it. It's not something I can necessarily, like, elaborate on, but, like, it's these are the things that I explain to my patients. I talk about deuterium and how that can affect the mitochondria. I talk about magnetism, the Earth's magnetic fields, and I like to educate my patients on the actual theory behind it all, because once they understand the theory, then they're just like, holy moly, I can't watch that TV like I used to. Like I either need to stop watching the television after 8 p.m. or I need to actually wear the glasses, and I need to protect my skin at the same time. So it's exciting because it's wonderful to watch people change. It's wonderful to watch people heal. It's wonderful to watch people undergo this process of. I mean, I guess it's alchemy at the end of the day, which is something I'm very passionate about, and um, and I guess that's my service.
Yeah. So let's talk a little bit more about lights, because actually, since just even seeing your reels, I don't know when I started following you, maybe 6 months ago, I can't remember, but since seeing your reels, I've made an effort to go outside every day. Like you've inspired
Amazing.
me to do that. And I guess the question is, so you've explained the blue light. That's the thing we want to mimic the natural flow of the sun. So the blue light is highest and most intense at the middle of the day, and it's lowest at the start and ends of the day. So we want to maybe not have screens at the start of the day, or make sure we've got our blocking glasses on, and do the same at the end of the day, mimicking the darkness that we would be in. And if we do need light, to use a red light like you are doing. And I suppose even using what we would naturally have in the outside, if before the modern world of fire and moon. So if you want to light a fire in your garden, that's fine, I assume. What would you say if, because many people will say, okay, I can get outside, but I can't necessarily get outside at sunrise and at sunset because of their schedules, their work day. Do you think it's important just to get out there, even if it's not at sunrise? Because sunrise is when we're starting to reset the circadian clock.
Yeah.
Would
Look,
you?
anything is better. Anything is better than nothing.
Okay.
But there also comes a time where it's like, well, I mean, it's a question I ask my patients.
Yeah.
You know, out of a score of 1 to 10, how do you rate your health?
Yeah.
And some may say 7, some might say 4, some might say 3, and then it's like, okay, on a scale of 1 to 10, how motivated are you to make changes to your lifestyle in order to change your health?
Yeah.
And they'll be like, oh, 8 or 8.5 or 7 or 9, and my response is, why is it not 20?
Mm.
Like if you're here because you want better health, and I'm explaining to you that your environment and your lifestyle is the reason that your health is not as optimal as it can be, as you want it to be, then when I'm advising you changes to your environment, to your schedule, in order to help you optimize your health, you're resistant to it, then what are we doing here? And it's not because I don't want to see them again, it's because I want to prompt them into thinking that, okay, I actually need to take ownership. I can't, um, I can't let go of this accountability and pass that accountability onto a pharmaceutical drug, or onto a doctor, or onto a surgeon. I actually have to take accountability myself. I have to change the way that I live. I have to change the way that I work. I have to maybe change my work arrangement. And it's not necessarily saying, okay, I need to I need to leave and find a new job so that I can watch the morning sunrise. It doesn't necessarily need to be that. It could be get to work at your normal time. Let's say it's 7:30, for instance, and check in and say hello to your colleagues, etc. But then go outside, after at 7:45 a.m. or 8 a.m. and just go and spend 15 minutes outside.
Yeah.
So it doesn't have to be necessarily before work. And then throughout the day, once every hour, once every 90 minutes, go out, have a 5-minute light break, have a touch point with the sun.
Yeah.
It could be, okay, I can't ground because I've got work shoes on and it's a nuisance to take them off and put them back on, etc. Okay, well, go and touch a tree.
Yes, that has become it's a touch a tree a day. That's my little thing that I'm doing.
Yeah, I like that. I like that. Touch a tree a day. That's got a good ring to it.
Yeah.
But it's just it's block the blue light. It's be willing to look different at work.
Yeah.
Let it spark a conversation.
Mm.
So then your colleagues like, oh, why are you wearing those glasses? Oh, because of this and this and this. You know, educate yourself so that you can explain it. Because then you're passing the message on to other people. And then all of a sudden, 3 people out of 7 in your team are wearing blue light blocking glasses at work, and all of a sudden, it's the new cool. Be the trendsetter. Be willing to be different. And you know, turn your Wi-Fi off when you go to sleep. Read a book instead of watching television.
Yeah.
Have your dinner earlier in the day.
Yes. Yes.
You know,
Yeah.
like you'd be surprised just how big a shift in health those 5 or 6 things that I did that I've just outlined. If someone were to do that religiously, how much of an impact it would have on their health? Because as I said, it's a quantum thermodynamic system. It's non-linear. Small shifts have massive implications throughout the body.
Yeah. My goodness, yes. I want to kind of vouch for the fact that these small shifts make a huge difference. And I've typically, just even reflecting on the menstrual cycle, I've typically always had a very long cycle, and that was considered normal. But me researching it more and looking at how important it is to kind of be within that range, just even the last 6 months of making huge changes, really, you know, getting outside, even if it's not in the morning, just at least spending half an hour outside and getting some sunlight, touching a tree, resting, sleeping on time, blocking blue light, the changes to just the length of cycle, and it now being in such, you know, a much better range. The changes happen so quickly. It's really, really phenomenal. What do you think that comes down to? Like, what's the mechanism? What's happening there?
It's better circadian timing of your hormones, and it's better build up, or I guess componentry within your hormones. What do I mean by that? Like your steroid hormones have got heaps of hydrogens on them. Like testosterone, for instance, has 28 hydrogens. But what if half of those hydrogens are deuterium? Then it just responds completely differently to sunlight compared to if all 28 of them are hydrogens. And deuterium, you know, the content of hormones, the deuterium content of hormones really boils down to how much deuterium is in the food that you're eating. And obviously, deuterium is higher in like processed foods, for instance, or coconut water, for instance.
Oh,
Um, Coconut water is not a health drink if you live outside of a latitude where coconut trees, or if you live in a latitude where coconut trees are not local.
okay. Okay. Keep
And
it.
so, yeah, it's like, I mean, people ask me all the time, "Oh, what's your diet, Jalal? What's your diet?" I'm like, it doesn't matter to you because it's postcode specific, it's
Yeah.
zip code specific, just local and seasonal. Imagine like creating an entire industry of like nutrition and diets and all this type of stuff when it really boils down to local, seasonal, and natural light.
Yeah.
And is your diet really restricted to just food, or is your diet also considering light? Because food fundamentally is stored light. So, what light are you exposing yourself to? Which is what I'm about. It's raising awareness about the importance of the blocking the blue light, natural exposure to light, getting more exposure to ultraviolet light, etc.
Yeah.
But then it's like, okay, well, what does these changes do for you? Like, I mean, yes, there's physical changes, but like, have you noticed a shift at all? This is a question. Have you noticed a shift at all in your own level of like consciousness or awareness? Have you noticed a shift in your own like resonance?
Yeah. I mean, even I meditate frequently. And even my ability to drop in and get there to that point of being absolutely nothing, unaware of my body. I'm noticing that previously it would be days where it would, you know, there'd be days where I'd be trying to find that spot and circling through thoughts. And now it's just that it just melts away, and I'm there in that quantum field, just pure awareness. So the speed at which I get there, not that it's a place to go, it's you know, in the eternal now. Um, but I have noticed that as well. And even my sleep, getting to sleep, I'm I'm having a good sleep. Let's just say that.
Awesome.
Yeah.
So,
Yeah.
so like that's all to do with non-visual photoreceptors.
Yeah.
And so like we have receptors in our eye that pick up color, um, and they can pick up light that we can see. So you've got like the rods and the cones. So the cones pick up red, blue, and green. But you've also got like an entire like body of like molecules that pick up light that we don't see. The infrared light, the ultraviolet light, that's light which we don't see. But like the water inside your body, and let me remind listeners that 99% of the molecules inside of your body are water. The water inside your body responds to both infrared light and ultraviolet light. So is that not like the biggest non-visual photoreceptor? And blue light degrades or reduces the amount of water that's inside of our body. And so then your awareness, your ability to sense the field, to drop into the field, is lower when it's being that very medium through which you drop in is being degraded by blue light. Of course it is. So like the cool thing is that quantum physics, and I guess building on that quantum biology, it's a gift to mankind because it doesn't just it's not just about being a nerd. It literally explains the deep science behind what is traditionally classified as woo-woo,
Yeah.
which is, I guess, perhaps why people find the way that I talk about it engaging, because I'm just your average guy that, likes to play a bit of cricket and football and, you know, forgot to get his hair cut and, like I'm just talking about stuff which is connecting the spiritual to the physical
Yeah.
in an easy to understand way, which is digestible for mums and dads, where they're just like, wow, like this makes sense, like it's worth a shot.
Let's go a little bit more into the light environment that your food is grown in versus the one that you're exposed to and how important that is and the mechanism there. And also this question that I've always had, and I think you've just answered it, is I've always thought, well, what am I supposed to be eating? Because my ancestors were from the, Sri Lanka or the northeast of Sri Lanka. I'm Tamil. Am I supposed to be eating what they were eating, or do I eat what is local and seasonal to where I'm living? And I assume that's the answer because that's what the light that my body is exposed to. But maybe it's not as black and white as that. And maybe there's a little bit of an overlap and an interplay. What would you say to that?
Well, let's start with the mitochondria. So the mitochondria is sensing the light that you are exposing your body to. If you are exposing your body to natural sunlight without sunscreen, and you're exposing your skin to natural sunlight, looking at, and so because those photons, that light has a specific spin to it. At a quantum scale, it has a specific spin to it and momentum. And then the electrons which are buried in the food that you are eating, those electrons have a quantum spin to it. And so when the food that you eat gets broken down into electrons and passes through your mitochondrial electron transport chain, the mitochondria is like the checkout person that's kind of scanning the barcode of the food that you're eating, the barcode of the quantum spin of the electrons, and making sure that it matches what your mitochondria have been picking up from your environment. And if it's the same, happy days. If it's not, then you start to head down the road of mitochondrial dysfunction. And so the light environment that you eat your food, that your food is grown in, is key, because it needs to be grown locally and seasonally in an ideal world, which I know is not easy because of like busy lives and 3 children and job and parents and Christmas and Easter and all these types of things. I get it. We're talking just ideal here. And so the seasonal local produce is grown in the same sun that you're bathing your body in. It doesn't necessarily mean you need to be spending all day outside sunbathing 5 hours a day, because our body has the ability to store huge amounts of energy at multiple layers, at a biochemical and biophysical level. But you just need to have a little bit each day, or if you've got a sunny day on a weekend, clear the schedule and cancel a lunch and go and harvest some electrons and photons. And so the electrons carry that information from the locally seasonally grown food and marry that up to what's in the mitochondria. So yes, you want to eat seasonal and local to where you are right now. The question is, Raji, should you even be where you are right now? Or should you be back home in Sri Lanka? Because that's where your mitochondria are going to be happiest.
It's crazy. Like when I'm there, I was in the north of Sri Lanka, which is in Jaffna, which is literally where my people are from. And my hair was amazing. My skin was amazing. I had zero pain in my body. I was glowing. I didn't find it too hot. I mean, it's pretty hot up there, but it was just perfect for me. I do feel that I'm here in, stereotypically rainy England, and it really impacts just the way you feel connected to life when you're just not where your feet on the ground. I was grounding. I was just walking around barefoot. It was just like you feel the ancestors, you feel that energy, you feel alive.
Yep.
It's a different level of aliveness.
100%, 100% agree. No, like there's a whole other aspect to light coming into the eyes, because light coming into the eyes drives all metabolism. There's a book that was written by an ophthalmologist about 50 years ago, and he says, and he explains how light coming into the eyes drives all metabolism. So if we look at the light, we look at the eyes, there's like the retina, of course, and light coming onto the retina, driving a lot of metabolic pathways from the hypothalamus to the pituitary gland, which controls hormones and circadian rhythms and all that type of stuff. But there's also different cones inside of the eyes: the red cones, the blue cones, the green cones. And this is where I'm about to take this conversation in a direction you probably didn't expect it to go. The cool thing about the cones, so the cones are like color receptors in our eyes. Yeah. Okay, so we've got a specific cone that picks up red color, a specific cone in our eye that picks up blue color, and a specific cone that picks up green color. But we actually have different cone densities amongst different people. Some people have more red, some people have more blue, some people have more green. So for somebody that has more blue, we can work out what is the highest. Well, we know the highest density of cones in their eyes is blue. Then the second highest density of cones in their eyes could be red or green, or vice versa. So somebody could be a blue, red, green person, or a blue, green, red person. You with me so far?
Yeah, getting it, yeah.
Similarly, a red person can be a red, green, blue, or a red, blue, green. Similarly, a green person can be green, blue, red, or a green, red, blue. So what has this got to do with anything? Well, the color blue corresponds to emotion and intuition. The color red corresponds to physical structure. And the color green corresponds to metabolic function, mitochondrial health, cellular energy levels, all that type of stuff. And so if somebody is a blue, red, green, then we know a lot about what their particular body type is. They generally have big eyes. They're generally very emotionally intuitive people. When they're going through anxiety or mental health issues, blue, red, green corresponds to metabolism. They might start to get gut issues. And the gut issues have got nothing to do with the food they're eating, but everything to do with the blues. Yeah. That's why it's called blue. So the type of work that I do now is like, I've spoken a lot about like the development of upper and lower jaws and like how that relates to the cranium, but like I do a lot of this other work now where I use kinesiology to work out what is someone's body type. And so then when I work out what their body type is, are they red, blue, red, or red, blue, green, etc., then I want to work out, well, what color are they seeing? Because like if someone's a blue, green, red, when I put blue in front of their eyes, is their body happy? Or what if I put the second color down, which is green, or the third color down, which is red? So I have specific color palettes which I hold in front of the eyes, and then I do a kinesiology testing on the arm to test where they're at. So if someone's a blue, green, red, then blue is their, if we think of them as like a car, blue is their top gear, green is their second gear, red is their third gear, or first gear. Okay? So, Raji, if you're a car, do you want to be driving and be able to drive in top gear, or you want to be stuck in second gear, or you want to be stuck in first gear?
You want to, yeah, you want to be in alignment with what is your top color. Yeah.
Your top color, okay. So if your top color is blue, your second color is green, but when I put red in front of your eyes, you go strong. And when I put the blue and the green in front of your eyes, you go weak. It tells me you've dropped down two layers. You're in your bottom layer. So now it's like we have to do some detective work. Why are you down there? And so that could be structural, that could be emotional, that could be biochemical, something they're eating, drinking, mold, whatever, mold contact, or it could be vibrational. So then sometimes we test the chakras. Sometimes I send my patients off to shamans to have that stuff cleared. So then when they come back, they're no longer a blue, green, red, seeing red in the eye. They're a blue, green, red, seeing green in the eye. So they moved up one. And so this whole process I like to call dental alchemy, because I'm marrying the mouth to the process of alchemy. So how does the mouth correspond to the process of alchemy? Well, I actually make mouth guards, or splints, which the patients wear while they're sleeping, which have a raised section on one tooth. So when they bite on that mouth guard, the mouth guard is only biting against one opposing tooth from the other arch, only one. And it bites on a specific cusp on that opposing tooth, not even just like a general biting on the tooth, it's a specific cusp. So I didn't devise this system. I learned it from my osteo, who had learned it from a dentist that passed away about 4 or 5 years ago. And so the system isn't really widely used. It's basically homegrown in Australia, of all places. So, but it's a culmination of many things, because, I mean, I'm sure you know a little bit about the Ayurvedic traditions, but like the blue, green, reds, and like these are like the doshas.
Yeah.
Okay, so this is the kapha, the pitta, the vata, and then the mixture of doshas, because some people are like, vata pittas or something like that. So, so when we had these mouth guards and they're biting on one specific tooth, one specific point on that tooth, because the roots of the teeth have like extensions into the jawbone, and when you're biting on that particular point on the opposing tooth, it sends a force vector through those roots, which then travels through the cranium and optimizes the movement of the cranial bones. And so straight away we take a person that's a blue, green, red, stuck in red, and literally we retest them 5 seconds later, and they're back to blue in the eyes. So we basically take them back to a foundation upon which then they can go and heal. And they can do the other things. They can do the nutrition. They can do the light. They can do all these other things. It's like a shortcut. It's like a short circuit of the entire central nervous system. We basically hack it. So how does it actually do it then? It's because when you have optimal, because remember, it's a different tooth for a blue, it's a different tooth for a red, and it's a different tooth for a green. So it's custom made that fits your mouth specifically, but it's also custom made to your body type.
The ectomorph, that thing, is that what we're talking
about? Ectomorph, endomorph, mesomorph, because one of them grinds like left to right, one of them grinds forward to back, one of them clenches. And so what if your teeth are designed for you to clench, but you're grinding left to right? That's when you're going to start to wear teeth down. So is grinding really that bad, or is it really getting people to grind the way that their teeth are designed for them to grind, which means bringing them back into their color that they're supposed to be living within? And so it just adds an entire different layer to the way that you do dentistry, because you're like, okay, well, if I'm going to make a dental restoration for a patient, what is their actual body type. So then I'm going to design the crown in such a way that is going to be like nice for their body type. Are they going to be flatter cusps, or are they going to be higher cusps, or are they going to be, kind of somewhere in the middle? So you design the crowns for greens, blues, and reds accordingly. So you design an occlusion if you're going to do a full bath restoration according to the way that their body is designed, the way that their body type is. But coming back to like when you're biting on these mouth guards and sending a force vector through the root of the tooth over through the cranium, optimizing the movement of the cranial bones, it then optimizes the pumping of the cerebrospinal fluid. And I believe the cerebrospinal fluid is the seat of the soul.
Yes.
And so when you have optimal pumping of the cerebrospinal fluid, you allow the soul to express optimally.
Yeah.
And you unlock the body's healing potential. You unleash the body's ability to heal itself. And so then you have a better chance of alignment of mind, body, soul, which is fundamentally what the entire process of alchemy is about. So it's a beautiful marriage of like dentistry and what my life passion is, which is alchemy and helping people on their alchemy journey.
So, do you have any job vacancies? I'm going to work in your practice.
Well, the thing is that I am, like more and more people are finding out I'm struggling to keep up with it, and like I'm actually getting to a stage where like I need another dentist to come join me, because I'm only one person, and it's not going to be long before I'm fully overwhelmed. So more than welcome to come and join the team. Yeah, 100%.
Yeah.
Like, I mean, if I knew this stuff when I graduated or like soon after, like, I mean, I'm so grateful that I know it now because like I'm still so young in my career, and I have, youth on my side to really help a lot of people. But there's also this compulsion to share the message and actually raise awareness about it so that more and more people can start treating this way because it is truly like life changing.
Yeah. When you were speaking about the three colors and the rods and how we have a natural alignment with a certain pattern,
Yeah.
I wonder what the impact. It's almost like if you're out of your natural alignment with those three colors and all of the other things, all of this kind of feeds into each other. If your cranium is locked up, or if your sacrum is locked up, if the food is not right, it's not grown in the same light environment that you're exposed to, if you're exposing yourself at all of these things will almost impact the way you express and choose just in life, the way you make decisions, the way you're able to make decisions about health even. Because if we're so out of alignment with our natural essence and our rhythm, and the cerebral spinal fluid isn't flowing optimally, how can we choose things that are healthy? I feel like the world has been structured in such a way where we can't be fully expressed. But if we don't make the effort to take that big step, then it's a self-fulfilling prophecy and a downward spiral of actually being unable to choose. What's your opinion here?
My opinion is like, I mean, yes, there's perhaps merit to your thought about, okay, there is some issues in society at large and the way that it's structured and designed, which is by design to make life difficult, to make it difficult for us to express. But is that a mistake, or is that the way that God intended? Because too many of us tend to fall into kind of this victim mentality of like, oh, like it's not fair that like this is the way that society is. But like I'm like, God wants it this way. That's why He's allowed for it. Because He wants people to put in the work and stop outsourcing responsibility and accountability to other people, to organizations, etc., and to take it on yourself. And so yes, there's definitely challenges at a structural level for people with physical traumas that they've accumulated along the way through sports, motor vehicle accidents, birth traumas, etc. Yes, there's biochemical challenges through the food that we're eating and glyphosate and Roundup and fluoride in the water and all these things. Yes, there's challenges at a emotional level with blue light, not to mention blue light's effect on metabolism, etc. yes, the challenges at a soul level because of the messaging that's pushed out through mainstream media, through social media, the expectations that are being pushed out upon young boys, young girls, young men, young women, mothers, fathers, on how they should be as parents and what's right and what's wrong, and polarization, masculine versus feminine, feminism, toxic masculinity, not understanding like what masculinity is, what femininity is, um, and that's coming from both genders, not understanding their own
Mm.
whether a woman is not necessarily properly understanding femininity and masculinity, and also for men as well. Um, so yes, there's challenges, but like that's the process of alchemy. It's actually working through those. And if you're even listening to this and you've made it this far,
Yeah,
then you've been chosen.
yeah,
And so yes, it's a massive uphill battle. Yes, we're rowing up against the tide, but like you've been chosen, and isn't that just a thrill?
yeah. And the journey truly is worth it. Everything you
Mm.
learn every day, the deeper you get to connect with yourself. And you're right. And it does give us the opportunity to relearn our connection to God and to our humanness both at the same time, like the matter and wave, like both, um, through things being the way they are, because otherwise we would just be out in the sun all the time and we wouldn't know any different. But the fact that that things are the way they are mean we have to intentionally choose God, and choose life and choose an open heart, and create that coherence between our own hearts and our brains, and expand our field and breathe better. Like simply breathing better makes you behave better, just on every level.
But you're right on all counts, and but fundamentally that hinges on a curiosity, a humility. Both of those are key.
Yeah,
A love from the heart, not from the mind.
yeah,
But more importantly, a submission.
yeah,
Like it's literally a submission to
yeah,
to God, a submission so that you are able to tame the ego, so that you are able to tame um, temptations,
yeah,
so that you are able to then unlock the true greatness and the true love, which is not necessarily going to be achieved with another person. It comes from within, you know. Marriage, like I used to think that my wife was my soulmate, um, and no doubt my entanglement with her has been the best ever entanglement in terms of its effect on my life, and hopefully she would agree the effect on her life. Um, but like, is there really such thing as a soulmate, or is it really just a love from within that is what we are seeking? And when we find someone we love, we are really just finding our own inner love through them. It's like projected onto them, and so we're really falling in love with ourselves again. Um, and I mean, this is something which like I've spoken about with her, and like she and I both feel the same. Like we're deeply entangled at a quantum level. Our souls are entangled, but we're deeply in love with God, and we're deeply like there's a huge reverence and submission and humility about that, and that is what drives the love that we project onto each other.
yeah. And imagine like that kind of understanding and depth and ability to speak about love and God in that way in a marriage, and the life that is created from that level of understanding and that level of consciousness, and how that impacts your children, and the field, this emergent field that comes from having a shared intention between the both of you, and how they're bathed in that, and what impact that will have on their lives. It's just um, yeah,
Yeah,
incredible.
I mean, I feel very grateful to be where I am right now in the way that I think, the way that I feel, the way that I believe, and I know it's not finished. The journey of alchemy is never finished, but it's a journey which I'm thoroughly enjoying, and I guess I feel so enlivened by it and so excited about it, and like I have this zest for energy, zest for life, which you could argue I lost over the last 3 or 4 years. It's been an interesting time, said with a wry smile. So globally, I mean, and so it's kind of like this has really brought me back to like what are the basics, and it's like all of a sudden life is a lot easier because I know what I'm here for. Like I'm here for alchemy. I'm here to go on this journey of alchemy. I'm here to align my mind, body, and soul. This is the great work. This is the Magnus Opus. This is the book I'm writing. It's just I'm writing it in my head,
Yeah.
and this is the life that I'm living. And like now that I feel this, I'm like I just want other people to feel this because it's just so amazing.
Yeah.
So yeah, it's super exciting.
It is. And I love what you said. Life gets a lot easier when you know what you're here for. Because
Mm,
even those challenges, um, you can hear the messages in them and what needs to be refined and how you have to course course correct or just shift the path a little bit. Everything is God's voice, even in the challenges, when you operate from that level of I know what I'm here for and I see the vision, and I'm humble enough to refine the vision if I learn something new, if the feedback um, inspires that change or whatever. Um, yeah, wow, I love that. I love that. And I'm getting this idea that there was a point just globally or just throughout your career where you maybe like me were thinking, I just don't know where I sit in this system and in how I feel about this. And um, what was your journey? What was that kind of that that point where everything pivoted and you saw it clearly and you knew what you had to do no matter how hard it gets?
well, I mean, there was a realization, honestly, probably about 13 years ago,
Yeah.
and then there was a that was followed quickly by a denial because that was easier and carried on just going about life and burying myself into the rat race and all that type of stuff.
Yeah.
And then there was another realization within the last 4 years, which was followed by like, okay, I need to take this seriously. Then there was like anger,
Mm.
and there was a good anger for about 6 months, and like consumed by wanting to really know everything that I could about it. And then there was like I guess a movement towards fear and preparation. What can I do to protect my family, protect myself? And that was really affecting me mentally. Then there was a period of disillusionment where I was completely disillusioned with the patients that I was treating, with my friends, with society at large. And I actually left Sydney and moved to a regional area which was only about an hour and a half hours drive from Sydney. And I reduced my work down from like 4.5 days down to like 2 days a week. And I sat and I studied quantum biology day after day, and buried myself in holistic health so that I could kind of have a bed of knowledge to kind of potentially avoid needing to use hospital system unless it was like an absolute emergency. And then that led to I guess a feeling of empowerment, and that empowerment then translated into okay, well, now let's start shouting from the rooftops. Um, and initially, when I started expressing myself, I'll admit there was a little bit of ego in the way that I was expressing myself, and I very quickly learned that that was a not necessarily serving anybody,
Mm.
wasn't necessarily giving the message justice, and that I needed to really like understand a lot more about the emotional, intuitive side of things, so that the message that I was conveying about health, about nature, about sunlight was going to be well received in a way which would then galvanize people to actually change the way that they think about light, and with God's grace, it definitely shows. I mean, for instance, you've changed the way that you think about light because of some of the things that you've um, you've learned from what I've shared. So I'm grateful for that.
Yeah.
Um, so that empowerment, then voicing it, and now it's more like I'm no longer worried about future preparation. I'm like everything is here by design. There's like a complete surrender.
Mm.
There's no fear. There's no fear of death.
Yeah.
There's um, there is no death. and it's that is literally the what went from a seeking of liberation within the realm of space time, you know, and now just a complete feeling of liberation at the soul level, where I'm at peace, and there's a lot of things that are going on in the world right now, which are disheartening to say the least. Um, but we also must always remember this is God's will. It's as God intended, and when you remind yourself of that every day, um, it helps make things a lot easier.
It does. It does. And with respect to that, it's like sometimes we see people as victims, when in fact they are modeling for us what true liberation is. I think I've gone through that little process of reframing things in that way, and having that download of being like, what if I'm the one that isn't free and they truly are?
Mm, mm,
And what that might mean. And even playing with different thoughts, like, okay, what if it wasn't what I am thinking now? What if I could pick a different thought and just play with it? And just like a Rubik's Cube where you're like trying to figure it out, just be like, okay, well, let's just sit with this for a while. And does that feel true? And is my heart opening with this? And does this allow me to feel less frustrated, less angry, less like, you need to go to, grab a sword and like go to war against something that's happening. Yeah. And just remembering it's part of this big plan that we at our kind of very zoomed in level can't necessarily see or understand. Um,
yeah, it in one word, surrender.
yeah. Surrender to life and God and everything in between. How is bringing all of this, because a lot of what you're doing is, yeah, like we said, it's an uphill walk. Making sure you're getting the right light and eating the seasonally and locally. How does your wife respond, because she's gonna have to get on board, and is she on board, and how does she feel about it?
She's definitely on board, but she's on board at her own pace.
Yeah.
So it's not necessarily something which I've enforced upon her. I kind of like when I bought blue light blocking glasses, I wore them first in the house. Or I would wear them if we were to go out to watch a movie or go to a family gathering, etc. And then slowly she was like, "Oh, Jalal, could you buy me a pair?" And then she bought them, and then she maybe didn't wear them initially in public, and now she's like, I can't handle this light. Like she'll take the glasses with her. They're in her handbag. You know, we've got water filters at home to improve the cleanliness of the water, um, and uh, and obviously, changing the light environment for the children, getting their sleep schedules on point, and getting their nutrition and food on point, and making a priority on the weekends around time in nature, time in the sun, grounding, and specifically saying no to family gatherings. You can probably attest to the fact that sometimes ethnic cultures can be a bit insane in terms of like what they want to squeeze into a weekend. So like we're getting better at saying no so that we can prioritize just sitting in our backyard grounding with skin in the game. um, and so these are all things which she has done at her own pace. I've never forced her, and I'm just grateful that she's, I guess, come along for the ride and is on board with it all. But when she's seen her own changes in her own physical health, I mean, the way she thinks is different. The way I think is different. The way I talk is different. I mean, this conversation, I could have never have dreamed about having a conversation like this 12 months ago. Like half of what I said, I wouldn't have been able to verbalize
Yeah.
or articulate. There's no way I would have been able to. And that's to say that maybe some of what I've said is wrong today, but that's okay. Like because I'm open to learning. I'm open to being critiqued so that I can be better, so that I can level up. And so it's exciting. It's exciting to watch her grow. It's really fulfilling for me have played a role in her finding her own purpose, and understanding this journey that she's on. And yeah.
Beautiful. That's amazing. The ripple effect. Um, yeah, building a life around this, around living well and connecting
Mm,
well. And like you said, like I've also cut down to 3 days a week now. And like, that gives me the opportunity of 4 days to get outside more and to touch my tree a day and to rest and to sleep and to cook and eat well and all of those things. And for anyone that's got this far, just giving you courage and that permission slip to like make that choice. We can run after the paycheck for the rest of our lives and not have all of these things and the benefit of experiencing nature and life and actually shortening our lives. I heard somewhere, and I don't know if this is true, that when we're born, we have a certain number of cell replications that are already determined. And how quickly that happens depends on our relationship to light and food and the circadian clock, for
that's
example.
that's spot on. And the science behind that is UV light slows down cellular replication.
Yeah.
So the more UV light you get, the slower the cycles of cellular replication are. Another way is excess blue light exposure from artificial sources increases how fast the clock in your eye turns, behind your eye turns. So that increased periodicity means that it might take 23.75 hours to get back to 12 midnight in your eye clock. And so time starts to travel faster. And that's how you accelerate towards death. Um, I said there's no such thing as death earlier in this conversation, but you know what I mean.
Yeah.
So, like, I mean, the most important commodity that we have in this realm of space time is that of time.
Yeah.
And time really boils down to light and you being able to trap light inside of you. Because when you're able to trap light inside of you, it increases coherence. It helps you make order from the chaos at a
Yes.
biochemical level. And the more order you have, the longer you can live and the healthier you can live. And you need electrons from the earth and from food, and you need UV light to excite those electrons. And that's basically health in a nutshell.
It's so simple. It really is that simple. Oh, I love that. I love that. I want to ask you one more question before we start wrapping up,
Sure.
about cerebrospinal fluid. You mentioned how you feel like this is the connection with the soul. And I've done a lot of work with cerebrospinal fluid and in terms of the breath where you are contracting the seven energy centers and pulling that fluid up and actually visualizing it moving past the pineal gland, and it literally will give you visions of fractal patterns. And I know there's Dr. Joe Dispenza does a lot of research. He has a great research team, and they have looked at this and the mechanism there. What is your kind of relationship with CSF, and what do you think it's doing, and what do you think the kind of healing capacity is within it?
So, cerebrospinal fluid is conveying information. It's helping to clean the brain so that it is more receptive to information from the environment. With a cleaner brain, you can tap into the field.
Yeah.
But the other thing is that it's an ultrafiltrate of blood, which is predominantly water, and water molecules are connected to each other via hydrogen bonds. So it's actually a form of structured water. And the angles and lengths of the hydrogen bonds is where memory is stored inside of us. So there's a well-known concept of water stores memory,
Yeah.
but where in the water is it stored? I'm 99% sure that it's stored in the hydrogen bonds between water molecules because they can be at different angles and different geometric patterns, and those different geometric patterns are basically symbols of a resonance, and that resonance corresponds to either a specific event or some sort of healing ability of the body, etc. So when you optimize the movement of the cerebrospinal fluid, when you optimize the light environment that the cerebrospinal fluid is exposed to, which is infrared light, ultraviolet light, natural sunlight, then that unlocks the powers that are trapped within the cerebrospinal fluid. So then that person's healing capacity healing can happen. And then they can start to think differently. Then they start to change the choices they make. Then they start to think less physical and more metaphysical. Then they start to ask questions. They have curiosity, humility. They present to situations with more love, less judgment, and all of a sudden their life takes on a completely different shape.
Yeah, because not only are they're getting the communication from the field, as well as that two-way connection is reestablished, that telephone line.
Plus whatever's buried within it is expressed.
Yeah. Yeah.
Because we are all the ocean in a drop, as Rumi said. So all the library of knowledge within the ocean is within us.
Yeah. Exactly. Amazing. So let's summarize. So we want to eat seasonally and locally. If you can move back to your country of origin, go for it.
Morning sunlight,
Yeah.
daily grounding, even if it's 15 minutes a day.
Yeah.
Morning sunlight, 15, 20 minutes a day. Prioritize time on the weekends when you're not at work to get back to natural environments.
Mhm.
Get outside, look at trees, look in longer distances. It's better for your eye health. It's blocking the blue light at night. Eating earlier, have dinner before sunset.
Yeah, have dinner before sunset. And devices like infrared lights. So there's difference, just to clarify for people, because I think some people have asked me this question. The red light that you're using is a red light, i.e. from the visible spectrum, but there's also infrared kind of devices. You get what I mean?
Most of the red light panels also release a little bit of infrared light, and there's like different wavelengths of infrared light. There's near infrared light, there's far infrared light, but there's a website called blockbluelight.co.uk which sells red light panels that also release infrared light. They also sell blue light blocking glasses. Make sure your homes are dark at night. Lamps with red globes on, like on screen here at my end. Because that helps to protect your circadian rhythm that you've worked hard to build with the regular morning sun exposures.
Yeah, perfect. Perfect. And do you have anything just on your heart that you want to express, that you want to say to either people that are potential patients, or just your average person or colleagues, anything you want to say to anyone?
A big open-ended question.
Mm.
I'm just going to say, think about what are your values? What is your purpose?
Mm.
Is your purpose and the way that you're living your life reflecting your values? And if it's not, maybe think about making some changes so that it does, because that is one great way to get back onto the road of healing. Nothing is a mistake, even if it's hard for you. It's by design. God doesn't give you a test that you can't handle. He loves you. That's why he's giving you these tests, because he knows you'll be better for it, and you'll do something with it, and you'll take it, the learnings, and amplify it so that other people don't suffer the way that you have. So go for it. The journey is alchemy. Enjoy.
The journey is alchemy. Enjoy. And one last thing, I was I don't know if I'm allowed to do this, but I was listening to The Diary of a CEO, and something he does at the end of his podcast. I finally got to the end of one of his podcasts, and he does this thing where he'll ask his current guest to come up with a question that I will then ask the next guest. So not knowing who it might be, on what their kind of topic is and what their area of expertise is. What question would you give for my next guest? Could be anything.
What are the three most important values in your life?
Beautiful. Okay, I'll ask them and I'll let you know their answer.
Awesome.
Okay, thank you so much. Thank you so much. Truly, truly, truly. That was amazing.
That's a pleasure. Thank you so much for having me and for holding space, and looking forward to listening back.
Yeah, me too. I'm like gonna take notes.
Speak to you soon.
Have
You
a good
take care. Have a lot. You too. Have a great day. Cheers.
day.